Welcome back to another informative and exciting episode of POTCAST, where we cover everything cannabis and hemp. If you haven't subscribed yet to our channel, please do so, as this will help us sustain our channel. And remember to cannabis responsibly at all times. Welcome to another episode of POTCAST. In today's episode, we are focusing on a company called Cannabis Clinics. And we are going to be joined by the Chief Strategy Officer, Greg, all the way in Cape Town. Good morning, Greg.
Morning, Mo. How are you doing? And
I am
good
always
morning
good.
to
Oh, yes. We're finally doing this. You've been running away from me like I'm a baby mama needing childcare from you, huh?
Not at all, not at all. I'm glad we're able to spend this quality time to go through and get your viewers, I think, some greater insight in terms of what we do at Cannabis Clinics. So thank you for the opportunity.
Awesome. Greg, let's just get into it. Please just explain to the viewers what a cannabis clinic is and how you guys operate.
Sure. So in 2018, when cannabis was decriminalized, we had already done a whole lot of work to have a look at what's happening on the international markets relating to medicinal cannabis specifically. As you very well know, there's two distinct streams to the cannabis sector. There's the recreational side, and then there's the medicinal side. We took the strategic approach to focus purely on the medicinal side, of which there were a couple of hurdles that we needed to jump through to ensure that we could be compliant with SAPRA regulations and obviously legislation as it stands here in South Africa, in order for patients to get access to legal medicinal cannabis, which is prescribed by a doctor and is also supported by a number of different conditions that SAPRA have approved where patients can access legal medicinal cannabis. So in order for us to ensure that we're compliant, we built a very strong network of medical doctors who we've trained on responsible prescription, on medicinal cannabis as a category. And we continue to train those doctors, and we offer those doctors CPD points as well, so that they can remain relevant within the particular sector. And at this point in time, we have a number of different doctors prescribing, and your patients or your viewers can go on to www.cannabisclinics.co.za, and there you'll be able to set up time with the doctor talking about your various conditions. And really the key conditions that we see patients suffering from largely relates to chronic pain, anxiety, insomnia. We also have cancer-related patients as well, in terms of wasting syndrome or nausea-induced vomiting, etc. So there are a number of conditions, and conditions are continually growing in terms of the SAPRA approval process. And really, from our point of view, is we want to make sure that this medication is prescribed in a responsible manner, and that patients can have access to this medication to alleviate their symptoms based on their medical history. In order for us to make it easier for patients, what we do ask is that patients register on intracan.com, and that ensures that all the relevant information is loaded. So when the doctor goes through the consultation process, they are able to easily identify what the conditions are. So it's been a wonderful journey over the last number of years. And yes, this industry is changing at a rapid rate of knots, and depending who you speak to, everyone has their own point of view. As I said, we're very focused on the medicinal sector. And our main aim is to ensure that we drive the appropriate patient care for patients who require a natural alternative to opioids that are currently on the market for pain conditions, etc.
Awesome. So do you guys prescribe the flower, or you just do the cannabis products only, like the oils and other products? Or do you guys also prescribe the Queen Mother plant as well?
So very good question. And in terms of patients and product available for patients, we have it in the form of oils, sprays, capsules, vaporizer, as well as the flower. So depending on the patient's level of comfort and how they want to administer the medication is depending on which product is ultimately prescribed to the patient. So we've got a number of cancer patients who would prefer to administer orally with oil. And we have a number of other patients who are very comfortable in inhalation with flower.
Oh, okay. And how does that work with the flower? Because we all know, even though it's medicinal, Do you guys give the cards? Do you prescribe them the card? Oh, you give them the card. You issue cards to them because of the doctor procedure and everything that you guys go through. Okay, and then how does that work? Let's say, for instance, I am driving and then the cops see that I've got cannabis on me. Do I just produce the card and then they will leave me alone? How does that work with the card?
Okay. So you're making reference to a card which is not applicable in South Africa. In South Africa, if you get a Section 21 application approved, it's on a named patient, named product basis. That application or that approval of that application is then deemed as the prescription, which does then guarantee you that if you are stopped by law enforcement and you have product on you, and that product references that prescription that has been approved by SAPRA, well, you have legal medicinal cannabis in your possession, so you should be good to go. In terms of the card, that's a process that happens in the US. It doesn't happen in South Africa.
That's very interesting to hear. Okay, then. You managed to get most of your products into Discam and Clicks. Congratulations on that, by the way, because I know a lot of people in the industry that are trying to do that, and it's a very tedious process. How did you manage to do that?
Correct. So at this point in time, it is deemed a medication, and patients visit various pharmacies across South Africa, and each one of those pharmacies are able to access legal medicinal cannabis if they have a patient that has a Section 21 approval. All that patient needs to do is go to their pharmacist and say, I have my Section 21 approval. I'd like my medication to be dispensed by you, because ultimately it is also about convenience for the patient. So we do have a relationship with Clicks Direct Medicines. We have a relationship with Arinel. We have a relationship with Greenways Dispensary and a number of other independent pharmacies as well. And that's driven through our engagement with those corporates and independents. And it's also been driven by patients knocking on the door saying, please, I need you to facilitate my prescription for me. So everything that is done follows through from a Section 21 application and approval. And once that takes place, we then can deliver that product directly to the patient's home. So the process as it stands now, if a patient wants access to legal medicinal cannabis, what they would do is that they would go to cannabisclinics.co.za. They would book a consultation with one of the cannabinoid specialist doctors there. And it's very easy. In terms of drop-down menus that are available, the patient makes payment for that particular consultation. And at that date and time period, the patient would then engage with the doctor. The doctor will go through the entire consultation process, define what the condition is, and then prescribe the appropriate product for that condition. The patient then pays their SAPRA fee, which is an administrative fee to SAPRA, at which point in time we then take all the elements through of that consultation, and we then supply SAPRA with the relevant evidence packs to support that particular condition. Once that approval takes place, which happens within a couple of days, we then deliver that product directly to the patient's home. So it's a very seamless process for patients. You know, patients can go through a virtual consult in the comfort of their own home. They don't have to visit a doctor's practice. But if any one of your viewers out there wants their doctor to prescribe medicinal cannabis, they can register on intracan.com. They then have their unique patient dashboard. And on that patient dashboard, they can invite their specialist doctor or their GP to become a prescribing doctor just via an email link, at which point in time we contact that doctor and we say, Mo would like you to become a medicinal cannabis prescriber because she's interested in the medication. Can we take you through the process, and can we train you on responsible prescription, etc., and cannabis as a medicine? We also take them through a training process in terms of our health tech portal on how that streamlines the consultation process. And ultimately, that doctor will then start prescribing to you as patient zero, and hopefully from then build their base of medicinal cannabis patients. So our view is that we want to get as many doctors to prescribe as possible. We do believe that this is a medication for the masses. And that's why we don't charge anyone for the training that we go through. We say to all doctors, the training that we present through to you is for free, because we want to ensure that we can expand your mind on the benefits of medicinal cannabis in order for the patient base to benefit.
Oh, interesting. And then you also mentioned a fee there that you need to pay to SAHPRA. How much is it that the patient needs to pay to SAHPRA?
So SAHPRA charge a 350 Rand administration fee per product that has been selected. Okay. So if a patient goes for a consultation and there's two products that have been identified, let's say it's an oil and a flower, then the patient would then pay 700 Rand for SAHPRA to process that application.
Oh, okay. And the Section 21 application, like you said, you guys obviously with Section 21 because it's medicinal. I know it's a tedious process, but is it costly? Because, you know, there's this impression that it takes long for one, like over a year or something like that, for you to actually get that license. And number two is that it's very expensive. Is that true?
Well, depends on which angle you're looking at. In terms of registering a medicine with SAHPRA, yes, that's a very costly initiative and takes a huge amount of time, energy, and effort, and money as well to be able to facilitate that. What we're doing in terms of each application getting an approval on a name product, name patient basis, you know, that process has to be compliant with SAHPRA's regulations and processes. And also you need to ensure that you build peace of mind with SAHPRA in terms of the submissions that you're putting forward are for the reasons that you state it is. So we're very comfortable in terms of the processes that we put in place to ensure that we can offer our patients the most seamless process as possible, to ensure that from consultation to delivery, it's in a very short period of time, and also making sure that we dot all of our I's and cross all of our T's.
Oh, okay. And now tell me, what advice would you give someone who's trying to establish their own cannabis clinic? Because it seems as though it's a lot of work, but it's not as stressful as it is setting up a cannabis facility. What advice would you give to someone who's trying to set up their own cannabis clinic?
You know, I think the same would be true across all aspects within the cannabis sector. You know, it all starts with the grow. From the grow, it then starts to how do we engage with international clients in terms of offtake agreements, and how do we deal with the local supply or the local demand through the Section 21 process. The key is for everybody to do their homework, understand what the law states, and how do you build your business within the parameters that's defined by law. So for us, we're very focused on medicinal cannabis, and there's a whole host of guidelines, regulations that we have to ensure that we follow to be compliant. And ultimately, our name in the industry is defined or dependent on our ability to execute within that framework. So homework, research is critically important in order to move into a space in any one of the sectors or segments within cannabis.
Oh, okay. And then for the very last question, are you guys linked to any cannabis facilities? Because I would assume you guys are linked to a cannabis facility. Is it in South Africa or is it in Canada?
So what we do is we have procured product internationally as well as locally. So we have product available on our platform, excuse me, for doctors to prescribe from Australia, from Canada, from Israel, and then also South Africa as well. So our aim is how do we grow our South African base to ensure that we work with the right grow houses that can deliver superior product, but also grow houses that have international relations as well.
Oh, okay. And do you guys assist people? Let's say I'm interested in starting my own cannabis clinic. Would you guys be able to assist me in getting that to be the case? Are you guys able to assist in that regard?
That's not our business model. Our business model is how do we grow cannabis clinics as a business unit? How do we increase our patient base? And how do we ensure that we continue to remain compliant within the framework of the law? So, you know, the industry is very small. We've had many conversations with different people within the industry. There's a lot of shared knowledge, shared ideas, and so on. But as I said, our main aim is to grow our patient base through cannabis clinics And I really would like to encourage your viewers to hop onto cannabisclinics.co.za and see for themselves in terms of how easy it is to access medicinal cannabis. You may be pleasantly surprised as well in terms of the price points that you will see for medicinal cannabis. And unfortunately, because it's a medication, I can't talk around price points here. But go through the process, and you will be pleasantly surprised at the price points that you're able to access legal medicinal cannabis.
Thank you so much, Greg. I think the viewers are very much intrigued, and I hope they will go into your website just to get more information. And it's a very, very user-friendly website, by the way. Very, very, very easy. I like that. Thank you so much for giving me this time to answer the questions that I had. And I'm hoping that the viewers now have more knowledge on what a cannabis clinic is and how you guys function and operate. Thank you so much.
Thank you so much for your time, and appreciate it.
Yes. And on that note, please do remember to cannabis responsibly at all times. Thank you so much for watching. Please don't forget to hit that subscribe, like, and share buttons below. We would also appreciate your comments. And remember to cannabis responsibly at all times.